I'm Maggie Jackson. I'm a dental hygienist and I've worked with people with gum disease for many years. I wanted a quick, effective way of showing them how to clean the areas where they have most bone loss and gum breakdown. That's between the teeth. So I designed a brush that had a curve that really cleaned to the base of the pockets between teeth. It comes in 6 sizes and 6 colours so that you can actually see the debris you've removed on the bristles. They're very, very long lasting and strong. Your patients will have different amounts of bone loss between different teeth. The worst is usually on the upper jaw towards the molars. So this should be the first place that they learn to clean, using the largest size brush that will fit. Your x-rays may give you a clue to which brush to use. And the brush is picked up and the 2 fingers are passed inside the cheek with the teeth really quite close together, and by feeling where the brush goes, the brush is inserted a little bit at a time by the patient, and once it's in place, encourage the patient to physically compress that soggy gum so that the brush goes into the bottom of the pocket. Perhaps you can see the subgingival reach of the brush as it takes the bacteria from the tooth underneath the gum. Continue to remove the brush, so the action is once in, once out, once a day in each interdental space. This brush may only fit in one place, but just go round and test and see if it will fit anywhere else. That being too large, move to the next size. Don't repeat cleaning the space that's already been cleaned, but move on and see if there's somewhere that this is the right fitting brush. Feeding in a little bit at a time and taking out just a little bit at a time, making sure there are just 2 fingers inside the cheek, so the brush wire is between the fingers and not poking into the mouth. Feed it through a little bit at a time with your fingers right inside so that you don't scratch your cheek lining. That's good. And you take it out a little bit at a time. Okay, that's great. And you work all the way around your mouth,
all the way.
As many as you
yeah,
can.
for example.
Use it there as well. Okay, and you take it out the same way, a little bit at a time. All right. So when you've done all the ones that this would fit, you go on to the smaller one, would you?
Yes.
Okay, just show us how you use that one. So you're feeding it through a little bit at a time with your fingers on the teeth. That's great. Oh, and you take it out a little bit at a time, and you're making sure that you get some compression on the gum. Okay, good. How long does it take you to go all the way around the mouth with the 2 or 3 sizes?
About 3 to 4 minutes now. Okay. It used to take me about half an hour, but about 3 minutes now.
Okay, that's great.